Hey everyone, welcome back to the Tooth Doctor YouTube channel. This is Dr. Yoo, the Tooth Doctor, and I'm Trevor. And today we're going to be talking about a stinky topic, what to do about bad breath or halitosis. But hey, like the saying goes, it's better to have bad breath than no breath at all, right?
Okay, yeah, that's true, I guess, yeah.
According to Medical News Today, 25% of people suffer from bad breath. What do you think about that?
You know what? I blame the people that have a good nose, right? So
true
yeah,
story.
you know, like if you can't smell anything, you know, if you have a cold, you can't smell anything. You don't know if somebody has bad breath or not. So.
And usually when you have a cold, you really have bad breath. Too. So I guess it's a win-win on both sides, or a lose-lose, however you want to look at it. So, Dr. Yoo, what is the major cause of halitosis?
Halitosis is basically bacteria-borne.
Okay.
Right? Bacteria. There's anaerobic bacteria. So certain germs that don't like oxygen.
Oh, okay.
And so when they are exposed to the air, okay, they die and they release off those gases.
Oh.
Okay? And that's where your bad breath comes from. Okay? So, you know, a lot of people have, you know, gum pockets. So if I were from a dental perspective, when you have pockets around your teeth, there's bacteria that get inside there.
Yeah.
And so I'll be honest, sometimes when I'm flossing and then as you clean things out, you open up those pockets and allow basically the oxygen to get in, and it kills off the germs, and then I can smell something. And so that's one of the big causes of bad breath, is just the pockets that you have where bacteria is inside there.
Okay. So besides your teeth and your gums, where else can that smelly bacteria live?
Your tongue, your tonsils, and sometimes just even in your gut.
Okay.
Right?
So how do you brush your tonsils?
That's a different story. Yeah, there's different things where people try and do. You know, mouthwash is very helpful in terms of killing off germs. But in terms of like brushing, you know, that's what they talk about. You know, brushing your tongue, brushing your gums. You know, people sometimes just focus on just brushing their teeth. You know, they don't want to get cavities. But the whole idea is to, you know, clean everything to minimize the bacteria content in your mouth.
Okay. So what is you might have already said this, but what's the easiest way to get rid of that bad breath?
Many different tips. You know, some people, you know, they use mouthwash. I actually met a patient where they use mouthwash and they rinse and gargle with it for like, you know, 20, 30 seconds. And then what they do is actually brush their teeth with the mouthwash in their mouth.
Oh, okay.
Right? And then they're cleaning away, and they're also swishing and getting that mouthwash in all the different areas. Okay? You know, different ideas, water picks, electric toothbrush, just to kind of get into those deeper crevices. But very important, again, flossing is very, very important. I know people are just like, oh, really? Do you have to say that word? It's something that allows to get the gums opened up, and you know, allowing the medication, the toothpaste, all that stuff to get into all the different areas to keep things clean.
Yeah, flossing is not the favorite thing of people to do, and that's why they're always bleeding and, you know, bad things going on there. But you have to floss. It's good for you, like eating broccoli. So why isn't gum or candy a good solution for getting rid of halitosis?
You know, gum is good. You know, there are certain gums that just help. You know, I'll give you fresh breath. You know, doesn't hurt to have a mint before a working interview or a job interview. You know, I chew gum when I go to the gym because, you know, they talk about breathing properly, having good, you know, with the form. But it's temporary, right? And so, you know, to have kind of longer lasting, you know, actually, you know, halitosis is, I guess, in a small sense, it's like a disease. It's telling you something's wrong.
Oh,
right?
Okay.
You know, so, you know, when you're doing that, it's saying that you kind of have excess bacteria, and we want to try and deal with that. Candy, gum, it's helpful, but you're actually also kind of feeding the germs and you're allowing them to kind of grow more, right? So, yeah.
Okay. So we talk about dry mouth and how it's bad, gives you bad breath. You know, how does that contribute? Like, what is actually happening when you've got dry mouth?
I would probably say dry mouth, it just, you know, when you don't have saliva or, you know, just the lubrication inside your mouth, it just allows for more food get stuck in there. It allows for the bacteria to stick to the teeth a lot better, right? So when things are wet, when you have, you know, good saliva production, it helps. It's a self-cleansing thing. You know, like actually, speaking of dry mouth, they call it xerostomia. A lot of patients that have dry mouth tend to get more cavities.
Oh,
okay. When you get, you know, people that get dry mouth, they come to my office and it's like, oh, 7, 8 cavities. I see them again, 7, 8 cavities. It's quite a bit, right? So people that, you know, have good, healthy saliva glands, they don't tend to have as many cavities each time they come.
So besides that, what are some other common causes of dry mouth?
The first thing that comes to mind, maybe number one thing, is just health. Okay. You're not healthy. If you're not doing things, then, you know, that affects your body, right? Why does somebody get diabetes? Why does somebody get heart disease? It's your health. Okay. In relation to that, there are people that are trying to be healthy, but because they're trying to be healthy, you know, they sometimes get prescribed medication. They say that if you are taking 4 or more medications, pills per day, a lot of combinations of the drugs can affect and cause xerostomia, dry mouth.
Okay.
Yeah.
Wow. So what if you're doing the brushing and the flossing, rinsing, gargling, and you still have bad breath? I've known people like this. Like they swear to God they brushed and whatever, but they've just got... Wow.
Well, you know what? Part of the other thing is the food that you eat, right? Like, honestly, if I have a pizza loaded with garlic and you had, you know, a salad, who do you think's gonna have the bad breath? So, you know, there is a relation with the, you know, kind of like inside your stomach, right? So the foods that we eat are also affecting the halitosis that we have, right?
Okay. Now, from a professional standpoint, could someone who has, let's say, a chronic halitosis problem, could it be a symptom of something more serious going on?
Well, a lot of times when I've seen patients, there is, you know, a lot of bone loss. Like I see people with their, you know, when I say pockets, that means there's the bone around the teeth are damaged quite a bit. And that's where you get the risk of, you know, gum infections and things like that. So the germs have kind of gotten underneath, you can't clean it out, and it's just sitting there, it's just growing. And so, you know, coming in, making sure that everything is healthy, making sure the gums are healthy, making sure all the bacteria is removed on a regular basis is very important in terms of minimizing chronic halitosis. There are things like, you know, from a overall physical body standpoint is like, you know, doing a detox. I won't go into too much detail, right? Because, you know, that's kind of not part of my field, but there are other things in terms of your gut that can be helpful in terms of minimizing the bad breath.
Awesome. Well, that has been very enlightening, and thank you so much for sharing your knowledge with us today. I really appreciate it. And if you guys want to hear more from the Tooth Doctor, please subscribe to our channel and give us a thumbs up. Appreciate it. Thank you. Bye.